Hello everybody, my name is Richard Hernandez. I'm a registered nurse at Bronx Lebanon Hospital Medical ICU, but I'm also a student nurse at SUNY Plattsburgh trying to get my bachelor's in nursing. I've been taking a course in management and leadership skills, and I've been following your manager, Ms. Joy Orr, throughout the semester. I did my presentation on improving patient outcomes on preventing CAUTI. I know that CAUTI has been a big initiative of this unit, and it's been involved in daily rounds. I tried to keep the presentation oriented towards staff, towards patients, and their patients' family members, because I think it's an intercollaborative approach to prevention of CAUTI. So I started off with what is CAUTI. CAUTI is a catheter-associated urinary tract infection that occurs when germs and bacteria enter the urinary tract and cause infection. It has been associated with increased mortality, increased morbidity, and increased healthcare costs, and it prolongs patients' length of stay in hospitalization. My objectives by doing this presentation and having this poster is to assist in reducing the monthly rates of CAUTI in the medical ICU at North Shore University Hospital, to educate staff, patients, and patients' family members on different strategies to help prevent CAUTI, and to improve patient outcomes during their hospitalization at North Shore University Hospital. A little background about CAUTI. Urinary tract infections account for about 30% of healthcare acquired infections that are reported by hospitals, and it results in a significant increase in cost and increased length of stay in their patients. CAUTI can be prevented in up to 70% of all of its cases, and good infection control practices could potentially prevent up to 380,000 incidents of infection and 9,000 deaths per year that are related specifically just to CAUTI. So, possible indications for urinary catheter use. If a patient has urinary retention or bladder outlet obstruction, if we're in a critical care unit, so if the patient needs accurate measurements when a patient is intubated and sedated, or if they have hemodynamic instability requiring fluids or vasopressors to maintain a blood pressure or cerebral perfusion. If a patient is going for an operative procedure, undergoing from the GI tract, the GU tract, if it's an anticipated prolonged surgery, they can possibly put in a catheter, but that catheter should be removed in the PACU. If a patient's to receive a large volume of fluids and diuretics during a surgery, that's also another indication. And if during the surgery, if it's necessary to record the INOs, that's another indication. If a patient has an open pressure ulcer, stage 3, or perennial wounds directly related to incontinent care, incontinent patients, that's also another indication. If a patient has unstable thoracic or lumbar spines, or has been involved in any traumatic injuries and requires immobilization, that is also an indication for use. I'm sorry, I'm just reporting right over there. If you could just step out of the way.
Geez. Let me get a chair. I'll bring it.
Last indication if a patient is at end-of-life care and it's needed for comfort measures. It's often not understood of what are the guidelines to removal of catheterization. So if you answer yes to any of those questions, it's possible to remove these catheters. So is your patient on intravenous sedation, drips related to acute respiratory failure? Is the patient neurologically compromised? Or is the patient in multi-organ system failure? If you answer yes, possibly consider removing keeping the catheter in. Is the patient experiencing hemodynamic instability, requiring titration of vasopressors or intravenous fluids for maintaining blood pressure or cerebral perfusion? Or is the patient less than 48 hours post-op from spinal surgeries? Or is the patient incontinent with skin breakdown stage 3 or greater and with a great risk of contamination? If you answer no to any of these questions, or all these questions, consider you removing the catheter. This section over here is the strategies for staff to prevent CAUTI. I took a lot of these off the CDC website. And use catheters only when indicated. Use aseptic technique with appropriate hand hygiene and gloves. As only trained staff are supposed to be inserting catheters. Secure the catheters after you insert them to prevent movement of the catheter and traction. Maintain a sterile closed draining system. Anytime that there's care required with touching the catheter, use proper hand hygiene. The patient should receive perennial care every shift. Maintain unobstructed urine flow with the catheter. The drainage bag should be below the level of the bladder at all times and should never allow it to get any more than 2/3 full. Anytime prior to ambulating, transporting, moving the patient, you should empty out the bag totally. It's a dry bag policy. It's important to remove catheters when no longer needed. You have to evaluate the necessity during your morning rounds and know the amount of days that the catheter has been inserted. Increased time in catheter stay has shown to increase rates of CAUTI. It's important to communicate during change of shifts, and you should address the necessity for the urethral catheter each shift. Document accordingly, and use reminder systems. I've seen on other units that they have, the sunflower for falls or something, just to bring something to remind staff that this is our progress, this is what we're doing. And if you have a male, if it's indicated, you could possibly use an external catheter. And if you do remove the catheters, you can use a portable ultrasound bladder scan to determine any residual and see if the patient's retaining any urine. And always, consider alternatives to different urethral catheters, such as intermittent catheterization. This next section is for patients and their families and how they can help in preventing CAUTI. It's important for them and for us to educate them and for them to understand why the catheter is needed, and ask the healthcare provider, ask the nurses, ask the doctors if the catheter is still needed. And if the patient has a long-term catheter from the outside, make sure that anytime that the patient touches the catheter, they clean their hands. Also, for the family members to keep in mind, and the patients, keep in mind the position of the urinary bag and to make sure that it's always below the level of the bladder. Don't tug or pull on the tubing, and don't twist or kink of the tubing so that the urine doesn't backflow. And at the end of the presentation, this is a statistic that was provided by the CDC. Each year, with preventing CAUTI, with good infection control, we can prevent 380,000 infections, 9,000 deaths, and we can save up to $451 million in healthcare-related costs. Thank you, guys.
Thank you. Thank you.